of the Montachusett Public Health Network. Today is Wednesday, April 24th, 2024. I call to order. Please be advised that FATV is conducting an audio and video recording of this meeting for public broadcast. I ask that anyone in the audience who is recording this meeting to please identify themselves for the record now, standing and stating your name and city of residence. At this time, I ask that all electronic devices be placed in silent mode. I invite anyone in the audience who wishes to speak to please approach the podium. Identify yourself by name and address and identify the agenda item on which you wish to speak about. You may speak on it for no more than 2 minutes. I do not see anybody virtual from the public, nor do I see anybody in our audience. So we will move to our agenda. I think it would be good for our viewers if we went around and introduced ourselves. I will start. My name's Steve Curry. I'm the Director of Public Health for the City of Fitchburg and also Chairman of the Montachusett Public Health Network. And I will go to my left.
I am Micah Blondo. I'm the Director of Public Health for the City of Gardner.
I am Michelle Powell, the Director of Public Health for the City of Leominster.
Phil Legere, Chair of the Royalston Board of Health.
Tom Bonsi, Health Agent, Clinton.
Ruth French, Administrative Assistant, Phillipson Board of Health.
Folks virtually,
Jim Abear, Health Agent, Town of Winchton.
Abigail, can you hear us? Jane O'Brien, can you hear us? I will unmute you.
Jane O'Brien, Interim Health Agent, Athol, Mass.
And Abigail must be muted. Try it now, Abigail. Maybe she's not there. Well, anyway, we'll move on to the agenda items. So the first item on the agenda is the meeting minutes. They were sent out a few days ago. However, I did, for those who weren't able to review them, they are in your packet in front of you. Any discussion on the meeting minutes from March 27th, 2020?
Move the minutes.
Second.
I do have just a
Discussion?
well, there was a second.
Yeah. Any further discussion on it?
Yes. Under training reminders, I did bring up the issue about removing the word field. I did get a little feedback, not necessarily directly from DPH on that, but we either can talk about it real quick now or do it when we go into open meeting. What do you prefer?
I prefer we discuss it now and make the amendment and we can
So apparently,
approve it with the amendment if that's acceptable to all.
Good.
Good.
Apparently that field has some kind of connotation that's offensive. My information was a decision made by one person or handful of people. So I am a little concerned and confused moving forward. Who's the arbitrator of words? So as a group, and we're part of the whole DPH networks, I don't know if we can reach out going forward, besides saying to take training. I'm more concerned of how the decisions are being made that then we have to live with. Farmers have a whole different look at field. We do, that's what we do. And I think we can go down a, what do you call that, rabbit hole?
Slippery slope?
So I just want to kind of put it out there, if we can reach back, because I'm sensing and feeling decisions are being made at the state level, and there's no real input from us. We just get the word, and then we're supposed to just fall in line. Same thing with, I don't want to get into the FEP part, but we just got a notice on FEP that we're losing our regional planners from the state level. Some decision was made, and we're going to talk about it at our regional meeting next week. My big concern is I feel there's a disconnect, and then we kind of just, things slide down to us, and then we're supposed to do it. There needs to be some kind of flow of needs to be some communication that actually is back and forth, and our back should have some weight, but I'm sensing it's them and then back to us, and we've been trying to do a lot, so it's not that, because they're really our partners. Anyways.
Any further discussion on this? So we have a second on the meeting minutes. I would assume as amended.
As amended.
If there is no objection, I will accept the meeting vote by take a roll call. So let's vote by roll call.
Who's that voice?
You
It's
don't.
Is that the man behind the curtain?
It's FATV, yeah.
Yes. So Ruth, if you wouldn't mind,
Ruth French, aye.
Tom Bonsi, aye.
Phil Leger, aye.
Michelle Powell, aye.
Micah Blondo, I abstain.
Steve Curry, aye.
Dana O'Brien, aye.
It is unanimous.
Jim Abear, aye.
Speaking of which, do we have a quorum?
That's a good question.
Do I have 9 or 8?
3 on virtual.
We have 3?
There is none.
Yep.
Oh, Gene, okay, good. Okay, just checking.
Okay, no further discussion. The minutes are approved. Second item on the agenda is a Stericycle update. I did check the Stericycle website. For those who are not familiar, Stericycle is our provider, our service provider for the kiosks that are located in each town's, well, most of them are in police stations, whereby residents can dispose of sharps and unwanted and unused medications into the kiosks. Stericycle is our contractor. We've had some issues with Stericycle since January. Is there any questions, concerns regarding the contractor still, or is things working a little better? Any discussion on that?
What was the question? Sorry.
Stericycle.
Stericycle, as far as coming to us?
Yes.
Part of the issue was I forget where I got boxes of containers. Was it from you folks?
Yeah.
When I opened them, they were the big containers for the
And they
wall
don't fit in.
mounts. Huh?
And they don't fit?
Well, the thing is, you can open and put them in there, but then they fill up quicker. So on the one hand, you're getting full of containers. It's probably can hold 6 of the small ones, but they take up more space. So I put them out there. When I picked them up, I thought they were the little ones, but lo and behold, they're the big ones, so we picked up too many.
I thought they were standard size.
So,
I just need another,
Royston, we did schedule a pickup for April 29th.
yep,
That pickup is not confirmed with Stericycle yet, but I'll let you know as soon as that happens. But you are also scheduled for every 24 weeks,
right.
which sounds like is now a problem. So I will request a,
Like three times a year, or what that, 24 is like twice a year.
yeah.
So we can just add a third, see how that goes.
Okay, why don't,
Obviously, you know, there's a cost, so we get that.
right. You want to go just 20 weeks? Try to,
We'll let's try
Minimize
that,
cost?
try that,
okay.
whatever works. As long as they can find us, that's always the important thing. And they show up on a day that the town hall's open, so as long as it's not a Friday, and it's not before 9 or after 3.
Is Royalston in Massachusetts?
It is, just barely.
Michelle, you had a comment.
Yes, they used to give us a schedule and they were coming, and now they're just showing up.
Yeah, there isn't an opportunity to print a schedule as of yet.
Okay.
It is on their website, and I know the Leominster folks are on that website. I encourage everybody to, you're allowed to put an account on the website and monitor it.
Okay.
If there's a problem, let me know. I can walk you through it, but at least you can take a look at. It does tell you when your next pickup is, and it's not the most user-friendly website. Not a lot of things are workable on it, but we'll continue to monitor it. If problems persist, then we'll move on.
Okay.
Any other discussion on Stericycle?
Steve, if I can just add some feedback in here, since it doesn't look like Abby is able to speak. I did receive some feedback from her in Westminster stating that their pickup appeared to be delayed or there was some issue with it. So I let her know to chat with you about that, but just wanted to bring that up now since...
Can you guys hear me?
Yes,
now?
we can.
There she is.
Yay, okay. I was
Might have
having
been my
some
fault. My apologies.
difficulties. I had to reload everything. Yeah, we had an issue where I don't know if it was that they weren't being alerted or how that really works, but our maintenance has been taking them, which I would rather have them not do if they don't need to, because I guess they're having a hard time at the landfill when they bring them there. So, yeah. And I'm sorry, I missed a big part of that conversation because my IT person was helping me
Oh.
with the thing. So I didn't really hear what you guys said.
I'm taking a wild guess, Abigail, that Westminster is collected every 8 or 12 weeks. But I can double check that for you. Is that schedule adequate for the town of Westminster?
I'll have to ask
Okay.
them because the police station is where they're held, but it doesn't seem like it is if they're contacting the maintenance when they have to have it emptied. So I'll have a conversation with them and see how frequently they're needing it to be emptied outside of the regular.
The Westminster Police have been vocal when there's problems, and we haven't heard from them in quite some time. So I'm assuming that there's no problem if there's no squeaky wheel. But if
Probably
there
the
is,
problem
please
was
let me know.
fixed because they turned it over to the maintenance.
All right. Moving on to the next item is the revolving fund balance discussion. Just a reminder to MPHN folks, we do have 2 accounts in the city of Fitchburg. As lead agency, we have our revolving fund, which was established in 2012, as well as we now have an account for the Public Health Excellence Grant. So we'll do one at a time so it's not so confusing. But the revolving fund, as I mentioned, has been around for 10 or 12 years. So I will go over that revolving fund so folks can understand it. Basically, on the last page of your packets, you will see the budget. I apologize I didn't send it out. I just got it done last night. But you will see the FY24 proposed budget, what we approved last year, as well as what our actual expenditures are. And I can go over that very quickly for folks. Our total salaried personnel is at presently $142,729. That is about 98% are case investigators. Those are the individuals that we'll be discussing a little bit further in our next agenda item. Any questions on that line item? Incidentally, most of the salary positions have been moved to the Public Health Excellence Grant. Why there are two expenditures to the inspector and the clerk, I will investigate. They likely will be moved to the Public Health Excellence Grant. Hearing nothing, I will move on. Contracted services is our kiosk in the town, which are medication and sharps kiosks. Presently, we are budgeted for $18,000, and as of yesterday, our expenditures are just under $14,000. And that looks like the only contracted item that we have in this fund. Any questions on that?
I got a quick question. MPH and nurse, so what's that different from the disease response team?
Well, we used to have a nurse that was on a stipend. That nurse since retired, 2 years ago, actually. And then we used to, actually, we contract a nurse in case there is a tuberculosis case, which requires some direct observation therapy, which we all know is time-consuming. We used to contract a nurse. We still do that, but we are funded for that in the Public Health Excellence Grant. So therefore, we haven't charged this fund.
So it's kind of there as a placeholder in case? Okay.
That's correct, yep. So moving on, if there are no further questions, we have a line item which basically is under material supplies and expenses. There's two line items there, and that's an error. I apologize, but our $258,801 is actually flu and an expense from flu and COVID vaccine purchase. Any discussion on that expenditure?
A lot of that's reimbursable.
You want to comment on that, Victoria?
Sorry, I can never remember if I need to press this button or not. Yes. Let me just bring up the reimbursement tracker that I have here. So currently, we have a gap in about $40,000 of reimbursement. Everything else has been reimbursed thus far. We will continue to receive reimbursements throughout the rest of the fiscal year, and the private insurance reimbursements are issued on a quarterly basis. And so just recently, we received a check from Commonwealth Medicine that was quite large. I believe it was over $100,000. And the next check we will receive from them will be in around June or so. And so as of June, we should have a more accurate picture as to what the reimbursements are looking like, but it seems like we did pretty good with reimbursement this year.
And then follow-up question, does that go into the revolving fund when it comes in?
Yes, it does.
So that would go in
To
the
revenue.
Fitchburg revolving fund or the Excellence Grant revolving fund?
So the Excellence Grant is not a revolving fund. So any
okay.
revenues would go into this fund, and it is actually a line item, third one up from the bottom. So as of yesterday, we have collected 203,000 for vaccine.
Okay, so just back up. You said there was 2 revolving funds.
No, only one.
Okay, that's what so there's a revolving fund, and then there's the Excellent Grant Fund.
Fund, correct.
But then that Excellent Grant Fund rolls over into the next fiscal year?
That's up to the DPH. This one definitely rolls into the next
Yeah,
year, which is why we separated. Because
Right.
last year, it didn't, PHE grant did not roll over. In fact, we had to pay back whatever we didn't spend,
Okay, so,
which is the next discussion on the, which is the next line item for discussion on the budget here.
all right, so I guess that's a good point of clarification, that whatever money that we generate should go in a revolving fund so we don't lose it, because we never know. It's Excellent Grant from administration to administration
Correct.
to whoever is in charge,
So,
But sometimes that fund does carry over
yep.
on the Excellence Grant? So far, it is. Okay,
So far it is.
just
but
checking.
It wasn't last year, so it's doubtful that it will carry this year, but
To give you an exact number, Phil, the gap in reimbursement as of today is $42,275.34. And the last quarterly reimbursement we received from private insurance, which again is only issued on a quarterly basis, was $103,366.15. And we will receive our next quarterly reimbursement from private insurance in June, and the Medicare payments are issued as they come in from Commonwealth Medicine.
Okay, thanks.
So moving on, our next line item is $110,690, and that is the expense or payback from last year's Public Health Excellence Grant, which was mixed into this fund last year, FY23. So that's basically what was unspent in FY23 and returned to DBH, which has been a whole another adventure, but we won't get into that. Any questions on contracted services and total expenses? Ruth, would you like a?
You have an extra copy of it?
Yes, I'm sorry. I wish you would have yelled. Want to pass that down?
You didn't get a packet.
Well, I had my agenda, so I was.
Yeah, she's got an agenda with nothing on it. Yeah,
Do you mind if I add a point of clarification, Steve, just for the public?
I don't mind.
All right. So, I may be incorrect in this, but it looks to me that that disease response team line item includes the positions for the shared services coordinator and the epidemiologist also. So that expenditure of $141,567 includes the case investigators as well as a partial salary for the shared services coordinator and the epi. Is that right?
I do not believe there are any expenses regarding the EPI. The EPI has been 100% PHE charged, and I do not believe a shared services coordinator is in that salary either.
Oh, okay.
That is strictly CIs, case investigators.
All right. I apologize. I thought this was the PHE expenditures also.
Which is why we didn't do both today, because it is confusing.
All right. Disregard that for the record.
Disregarded. All right, so we're back to expenditures, total expenditures. That 526 number is obviously incorrect, but any questions on the expenditures? So that 526 number is bloated by the two $258,000 expenses. Any further discussion there? If not, moving on to revenues. Under grants, the grants line item includes the $240,000 grant for the CIs from DPH, as well as I believe it contains the $75,000, which was the final quarterly payment from FY23 that actually didn't happen or didn't get posted until FY24. So it's showing up in FY24. Does that make sense? Mm-hmm. Which makes a total of $315,000 in revenue.
Sorry, I was just trying to.
Just trying to make sense out of that number. Annual assessments, that is what each town pays. That is $17,800 total. The next line item is fees for services, and 99.9% of that $203,000 is vaccine reimbursement. Any questions on total revenue?
Under annual assessments, going back, FY21 and 23, it's higher. Was there a reason why it was higher?
I think what's happening there is assessments. In fact, I had the same problem yesterday trying to sort that out. Assessments revenue was getting mixed into kiosk revenue.
Okay.
From what the towns paid. So I had to do a little math.
It wasn't separated.
I suspect that number in FY23 was not separated.
You got to keep them separated.
Yes.
Nice reference.
That was our recycling theme song back in the day.
Good, Phil.
Any questions on revenues? So this shows revenue presently of about $19,000. As you can see, our original budget actually cut into some of the expenditures that we proposed because of the vaccine expenditures. So I don't think the account is actually doing as well as $19,000. So we'll take a closer review and I'll send that out to folks. But as of March 29th, the end of the third quarter, the revolving fund balance was $205,936. And if you add up all the total revenue in the years that the account did well as the years it didn't, it's pretty close to the $205,000. But that is mostly dig money from about 10 years ago. We had about $200,000 that the DPH let us keep of the dig grant, if you recall.
Yeah, I recall the dig grant.
Yeah.
We drank the Kool-Aid.
Yes, we did.
Yep.
So how do folks feel about this? Should I make the amendments for the next meeting and then vote on it, or?
If you have, we can make the amendments now and just vote on it
Do
now.
that too.
So I move the budget sheet with amendments.
Second.
Second by Tom. Any further discussion on that? If there is no opposition, I will accept a unanimous vote. Roll call it is.
The man
Rod
behind the
speaks.
screen.
Ruth French, aye.
Tom Bonsi, aye.
Rozier, aye.
Michelle Powell, aye.
Micah Blondo, aye.
Steve Curry, aye.
Up top,
Abigail Conlon, aye.
Jim Abear, aye.
how about Jane?
Jane did already.
Her name's there.
Let me
We
check.
don't hear opposition. You got her muted? She's muted.
She is muted.
She's muted. Well, she doesn't answer. There's not much you can do.
No.
It's still favorable. Moving on.
Moving on.
Oh.
Thank you, folks.
Where'd she go? Disappeared. What'd you do to her?
You scared her, Phil.
Scared her.
So the next line item is the PHE line item for the next 3 years. That is simply, we were informed yesterday that the Public Health Excellence Grant will be level funded for the next 3 years. Heard that before?
Yeah, heard that. It's better than hearing that it got cut, which that happened in the DIG grant, second year. Oh, we're sorry, we lost our federal funding. We're going to cut you. No, you're not. So we'll take level funding, right?
Yes.
I'm looking at this, by the way.
Yes.
There's more money here, access, than we ever had.
Yep.
Remember when we were counting dimes and nickels?
Nickels and dimes. Yep.
So that part is good.
That's correct. Any further discussion on the level funding of the Public Health Excellence Grant? All right, moving on to the agenda, we have Impact Melanoma Respiratory Clinics for the 24-25 season, which includes shingles and pneumonia update.
Thank you, Steve. I'm going to go out of order if that is allowable, just because my notes are in a different order, and I don't want to lose.
There's no objection. I do not have an objection.
Okay, very good. I'm actually going to start with, in Catherine's agenda item, the disease investigation team update. I have some data that I've pulled for you all to share. Starting with MAVEN, it has been a very busy calendar year for MAVEN investigations. The MPHN has investigated 50 cases in MAVEN since the start of the calendar year, January 1st. This excludes any cases that were not investigated by the MPHN, which would include the City of Leominster, which are handled by Stacy, Clinton, which is handled by Lorraine, and Hubbardston, which is handled by Judy O'Donnell. And so those 50 cases represent the 10 other communities in the MPHN. The breakdown by disease category, there have been 21 cases of enteric disease, including Salmonella, Campylobacter, Shiga-toxin E. coli, norovirus, and Yersinia. There have been 4 zoonotic cases, including babesiosis, HGA, and malaria. There have been 3 viral hepatitis investigations, including hepatitis A and acute hepatitis B, 4 investigations of group A strep, 3 investigations of Mpox, formerly known as monkeypox, and 15 investigations of vaccine-preventable diseases, including mumps, measles, Haemophilus influenza type B, and varicella. I will note for that category of vaccine-preventable diseases, often what happens is the cases come in as a suspect, either based on preliminary test results or clinical presentation, or both. And throughout the course of the investigation, that suspect case may be revoked based on our findings of the investigation or based on additional test results. So for clarification for the public, an example of that is measles. We have not had any cases, any confirmed cases of measles in Montachusett Public Health Network communities in this calendar year or recently before that. Those measles were investigations which are happening more frequently in light of the rise in measles cases nationwide. And so I believe we have done 3 suspect measles investigations, which thankfully were all eventually ruled out. So just some clarification on that category. And then lastly, the MPHN is also currently managing 4 active cases of tuberculosis. Is there any comment or questions on any of those data points? Very good. The next update I have is from our resource coordinator. As you guys might be aware, we have a resource coordinator on staff at the MPHN that is funded by the, quote, disease investigation grant by the State Department of Public Health. This resource coordinator is tasked with coordinating resources for residents and helping them navigate resources that are available in the community, including food, housing, access to health care, such as primary care and health insurance, access to the internet, all of these very important social determinants of health. And since the start of the calendar year, January 1st, our resource coordinator has managed 60 new referrals, in addition to managing her old referrals from before the calendar year started. Any questions on that? Nada. Very good. All right, our next update from the, quote, disease investigation team is in regard to our pilot project with the childhood lead poisoning prevention program. As we discussed before, this pilot project involves providing families who have children with elevated blood levels between 5 and 9 Venus with case management services, including education and guidance to help prevent the eventual lead poisoning of that child. So our goal is to intervene while the child's blood level is elevated before it gets to that poisoning benchmark, in which then the state-managed CLIP case management would take over. And that's when all the inspectional pieces then get involved. So since the start of September, we have had 19 cases, 19 children across the MPHN with elevated blood levels, and 15 of those were provided with services. The other 4 did not answer the phone, which is why they were not provided with services. Happy to report that of the 15 that we provided with services, none of those children have then subsequently so far converted to poisoned. Their blood levels have decreased following our intervention and services. So that is a really positive sign, I think, for this program, and I think the CLIP is really pleased to see the outcome of us doing this work, because this is currently only being done in 2 communities in Massachusetts, or I guess the MPHN being a group of communities and the other one being the city of Lawrence. Does anyone have any questions on that? Okay. Very good. So that concludes the disease investigation team update. I will move on to Impact Melanoma. Impact Melanoma is an organization that's dedicated to reducing the incidence of skin cancer and melanoma through prevention and education initiatives. We may have the opportunity to collaborate with Impact Melanoma through our Public Health Excellence funding. This is pending the approval of us utilizing our Public Health Excellence funding through the State Department of Public Health. I am positive that, or hopeful that we will be receiving that approval, but as of right now, I can't say for sure, so this is all tentative. But what a partnership with Impact Melanoma would look like is, pending approval of funding, I will create a menu, for lack of a better word, for towns to select what type of initiatives you would like your community to participate in. Of course, this will not be an administrative burden on the town. The MPHN staff will lead the execution of those initiatives, but the towns can decide what you would like done in your community and what you would not like done in your community. An example of some things that would be included are sunscreen dispensers. So if this funding is approved, we will be able to purchase sunscreen dispensers with the associated sunscreen, of course, to place in high-traffic community spaces such as pools, splash pads, high-traffic parks for the public's use, with the idea of working toward prevention with the use, with increased use of sunscreen in the public. Another example of something that may be included in that menu, if our funding is approved, is a curriculum for our school systems, a one-day curriculum for our school systems to integrate into their existing health education classes to help educate middle and high school age students on the importance of sun safety, on the impacts of using something like a tanning bed, and the importance of sunscreen use during summer months. So those are just a couple of examples. I'm hoping to hear about this funding by the end of the week. If this funding is approved, can I have an indication from all of the towns if this is something that you would be interested in? So if your town is interested in participating, can you give me a show of hands so I know who to reach out to?
We could do a roll call.
I think I see everyone in person raising, and Abby and Jim. All right. So everyone, for the record, everyone that is present indicated. So once we have an update on the funding, I will reach out to each one of you individually, and we can make a plan that's specific to your town on how we can work on this. I imagine that it will involve partnerships with the Health Department, of course, the Park and Recreations Department, and potentially the Department of Public Works, depending on how your town is structured and what the staffing looks like. Does anyone have any questions or comments on Impact Melanoma? Nope.
No questions.
No questions. All right. The next agenda item is an update on our respiratory clinics for the 24-25 season. Believe it or not, it is that time of year again to start coordinating our schedule for our respiratory clinics in the fall. At this time last year, we had started that already, starting with the highest risk groups, senior centers and senior housing, and trickling down to other public spaces that frequently benefit from respiratory clinics, including our schools. The reason why I have not started on that yet is because the ACIP is changing the timeline for the COVID vaccine recommendations and approval. Last year, which was the first year of commercialization, the COVID vaccine recommendations and approval happened in September. And this greatly delayed us receiving our COVID vaccine, which was quite a challenge for us being able to advertise clinics to the public, since we did not know what vaccine we would have until we actually received it. We did not receive our COVID vaccine last respiratory season until October 11th. And at that point, we had already been doing flu clinics since September 19th, so that was quite delayed. For this year, the ACIP is planning to vote on recommendations for the new COVID vaccine formulation in June. The issue with that, though, is the FDA approval for the new formulation is still scheduled to happen in September. So I am waiting on an update from our supplier, McKesson, to let us know what the timeline is going to be looking like for us receiving vaccine, because I would really like to avoid all of the confusion from last year, if possible, on what vaccine we are having at what clinic, and it was unfortunately quite messy, even though it was beyond our control. So once I have an update on the timeline for receiving COVID doses, I will get started on scheduling our high-risk our clinics for our high-risk populations, which include the senior centers and the senior housing, and then move on from there. Our flu pre-book is placed, and so we are all set. And so tentatively, pending COVID vaccine recommendations, we will have COVID vaccine, high-dose flu vaccine, and the standard flu vaccine at our respiratory clinics in the fall. If there is any town who did not have a respiratory clinic in the fall, or if you had a respiratory clinic in the fall and you would like one at a location that did not previously have a clinic last year, please let me know. because my intention for scheduling the clinics will be to use the schedule from last year. So if there's anything missing from the schedule last year that you would like to have a clinic, let me know and I will add it into the list. Does anyone have any questions, concerns, comments on that? Nada.
No question.
Okay. I guess I'm being very thorough then. The last update is shingles and pneumonia. We intended to host shingles and pneumonia vaccine clinics this spring at our senior centers as we did last year. Unfortunately, that is, as you can see, it is April and it is delayed due to some delays with our provider. I'm still hoping to make that happen. At what scale, I am not sure. So hopefully by the next meeting, I will have an update for you all on what the status of that is. Does anyone have any questions or comments on that? All right, I'll take it. Back to you, Steve.
I believe there is an IMA update. Do you want to take the thunder on that one, Catherine?
Yes, happy to do it. Yes, so Catherine Hoover, MPHN supervisor for the case investigators and also shared services coordinator for the PHE grant. The IMA update, so in our February 7th meeting, we had a robust discussion about amending our IMA, and it was an ask as part of the PHE grant that we amend our IMA for a couple of different reasons. We brought our concerns back to DPH, and they had agreed to remove that request if MAHB was satisfied with the way our IMAs looked. So the IMAs have been sent to MAHB. MAHB has reviewed our IMAs and found them to be in order and no revisions are required. This was great news. I'm very happy to hear that, and we just heard that about a week ago. It was a long process. So the IMAs are going to stay as is and not be amended or revised. So that is following up with that and filling that circle in. That is now a done deal.
Follow-up?
Yes.
Go ahead, Phil.
I think it's important to note that process, because if we accept whatever is devised at a different level, that they're not in direct contact with people. They're in contact with themselves. And they have a different agenda, and we get that. But I think it's important for us, if something creates an issue, I think we just need to speak up. Again, it's a partnership, it's supposed to go two ways. So going forward, I understand the whole focus on everything, even in the FEP grant, is equity. Mm-hmm. But if we don't have any voice in determining what something is, I think that's a bigger concern for us.
Yeah.
Because things are going to, if we don't say anything, more stuff's going to come, as we know, because it's their job to think of things, and for whatever reason. But we're the ones that have to actually formulate, or, we're doing the work. So, and the politics, again, which they claim is not they're not involved in politics, they are. Because there's the state politics and then us with our individual towns. So I think we should be celebrating, on the one hand, that we're still here, and we've added folks, and it has a benefit to us, it really does. And, just looking at our funding moving forward, we had zero funding. And then again, if you look at our assessment And this whole package, our assessment is basically 14,000 by the individual towns. So anyways, thank you for your efforts.
It was definitely a success story. Yeah, I think that because DPH didn't see our IMA done in the last 2 years, they kind of forgotten it had happened. And so us highlighting the success story of what the MPHN is and showing them that it's functioning, we have a governance board that's functioning, and have regular meetings and all get along well with each other, that they were able to move forward from that and realize that there's no revisions that needed to be done. So it was a success story. And like you say, Phil, it's a good reason to be alert and to, question the asks that are coming. So it was a great example of that and a great success. So yes.
You mentioned, we get along. That's important because there's other groups out there, as you know, that they're informed. Someone breaks off, goes with somebody else.
Yeah.
They haven't really settled this whole process in general, even though it's been in process for 20 years. It's still new for a lot of folks in the state. So
Yes.
stable networks.
And
like
we are
us,
considered
they
a
should
stable
be-
network from their
should
point
be
of view.
celebrating us.
Yes, yes. Yeah.
And understanding the lessons
Yeah.
of why and how we got to this point.
And that was the result, so it was excellent. Yeah, very
But
happy.
I really think with the local regional public health group, I think they need an advisory. They need something. I'm not sure where our input,
Connection is.
except when we bring something up, where is it? I think that's the bigger issue going forward, is a voice for us in the active policy making. Because if they're doing
so
it,
many divisions right now that it's hard to have a voice in any of them and where those policies come from, I think. But we certainly are trying.
because it's insular on their end, and then there's a whole other generation new to the whole local public health scheme that I'm not sure really knows where our history or the history of local public health, or really totally grasp it. I mean, it's good that we have Sam Wong there, and then Kristen Black, she's there now. And there's so there's folks that come from local public health. Anyways, good.
Phil, I believe there are advisory groups, OLRH advisory groups that are separated by topic. I know communicable disease is one of them. I don't know the details. I joined a group chat of regional EPIs just recently and saw they were talking about it back in February. So it seems like that opportunity has passed for this calendar year, but I can share that with you maybe for future reference.
Yeah, if there's an actually, on one level, they should have a rep from every network and alliance that can meet, quarterly on policy or something. I know we at one time, and it's still functioning to a degree, on the FEP grant, the Local State Advisory Committee, and that came out of trying to keep the funding as much local as possible and trying to follow the bouncing ball of the funding, because there was this mistrust. So, I mean, mistrust doesn't help anybody. So if there's some kind of group, they should want a voice, you would think. If they're trying to make this thing last,
Yeah.
and then trying to find out what works, what didn't work, or who's successful, who isn't successful, who's sustainable, who isn't, they really need active voice from
We'll
the
keep our
local
eyes
level.
open for those focus groups coming up and definitely participate, as we can. Any other questions about the IMA?
If I just have a comment, I think we need to be cognizant of our acronyms that are getting thrown out left and right.
Yes.
We might be helpful to viewers and our newer clerk, and I'm doing it myself, I apologize, but
Yeah.
the IMA stands for the Intermunicipal Agreement between all the communities. Kind of an important note there. We had
It is.
10-minute
Thank you so
discussion about it.
Yes.
And then the FEP grant is the Public Health Emergency
Preparedness
Preparedness
grant, which
Yes.
was for emergency response and setting up emergency dispensing sites. However, the new 5-year grant, they're shifting to sheltering, which we weren't able to touch before. And now we're going through this review, and now that's the new focus. And you want to know why it's a new focus? Because the state realized they can't handle it. And so they want to bring us in, whereas they didn't really want our participation before, but now they do. So now that's being drawn in, whereas before, we got our hands slapped for trying to include that. So it's very interesting to follow the bouncing ball, so to speak. Bouncing as in up and down.
Anything else?
All right. I can.
About the intermunicipal agreement?
Yeah, I don't think there's
Okay,
any other
we can
questions
move
about
on.
the IMA. Okay. My next item I'm speaking about is digitization. So this is speaking of something from the Public Health Excellence Grant, PHE grant, that they were tentatively offering money to help towns and cities digitize their records. So that means inspection records to be, in other words, scanned in, computerized, and searchable in a database. And this is not actually looking good to move forward. This was an item that they wanted done within this fiscal year and has not looking like we're going to be able to get there. With the fiscal year being almost over. It's not a done item. We're still working toward it, but I can honestly say it's not looking as good as it did a few months ago. So I will continue to update you on that if it is available, and we're not sure whether it's going to be allowable for next fiscal year. Working toward this, as I know most towns are in need of this, and I'm bringing that forward to the folks at PHE as best I can.
Point on that?
Yep.
Many of us have just part-time admin staff. I mean, literally, how many hours do you work, Ruth?
I work maybe 5 hours a week.
I have an admin first time, about 4 years ago. She's 5 hours a week. I'm sure some of our other boards, the cities, you have some admin staff, but I'm sure they have a lot to do. So there's staff, that's an issue, and then capacity.
Right.
Computer capacity, this stuff probably should be in a cloud, but, we don't have a cloud yet.
Right.
I'm sure it's there someplace.
And that would be created as part of one of these projects, but
So
yeah.
there's time and the actual physical
There's
equipment.
definitely the need, yes.
So, something like this, I could see it where moving forward, you could scan an item and have it someplace, but I don't see us digitizing going backward.
Past records, yeah.
The most important records to be digitized would be your Title V reports. Those are the ones you get requested a lot from folks. That's like 18 pages. And then if you try to put a septic plan in there, they're not always in a PDF form. So you got to do that. Those are the most, in the smaller towns, or even in the cities, that's an active, part of commerce. So
Yeah.
that's more realistic. Then the other ones would be food inspections. get trolls out there, want to go troll a health department and see if they're doing their food inspections correctly, so we can get a request for information. And then you got housing, that's a multiple page.
Yeah.
And don't even talk about lead determinations. Those are even more.
I won't
Yeah,
talk
so-
about it.
Oh, sure. So
Yeah.
pick one. If you were to pick one, I would start with Title V.
And that, like I said, it's not looking good at the moment, but it's not done. It's still an ask and still trying to move forward with it. So that's, any other comments or questions about digitization? And next on my list is MPHN branded clothing. So we have some grant money from NACHO, otherwise known as the National Association of County and City Health Organizations. Did I get
Officials.
it? Officials. Oh,
So close.
Close. A grant from what we call NACHO, much easier to say. And part of that money is for MPHM branded clothing, so most used for shared staff. So we have our inspector working part-time for shared inspections for the towns that don't have the capacity to do them, so Pete DeLorme. So some MPHM branded clothing for him, for Victoria and I that do the clinics among multiple communities. It's appropriate for us to have that label on us of why we're working for, say the city of Gardner when we're employed by the city of Fitchburg. So that MPHN clothing, and of course our shared clerk who works for the MPHN. So the clothing would not be appropriate for all health departments staff for all of the communities, but for those who are public facing in especially those clinic settings. So like our nurse from Leominster who's here behind me, Stacy, does several clinics with the MPHN in the city of Leominster. And, Micah, Michelle, those of you who are present at clinics, very appropriate for that too. So anybody interested in that, reach out to me. We're going to work on getting that ordered together, and we'll order some things up, branded.
What's it look like?
MPHN. I'm sorry?
What's it look like?
We don't know yet.
I mean,
We have to figure
you have
that
a
out.
logo,
We have the logo, yep.
so I mean, is that basically what you're going to use?
That's basically what we'll use, yeah. We don't know what type of shirts or vests or that. We haven't discussed that yet, but we can certainly do that for those involved.
Or the public health, the general public health logo. I believe the active shooter training, Ange was wearing some MPHN swag with the, I don't know how to describe it, the public health logo.
Yeah.
And it looks like
It's
that
this.
was...
I don't know. That's how they came up with it. At the end, it just went, I don't know, that's
Wow,
it.
that's what it looks like. Yeah, that's good.
It can be a group
I can do
decision, a discussion
I
on
think
exactly
you should
what
use
this...
what we have. You don't have to recreate something.
No.
And then, the public health one is pretty generic. If we're advertising the network, we need to use the network.
Yep.
That's, and it's in there.
It is in there.
And then lastly, Steve, I just wanted to bring up about the approval of the minutes from the beginning of the meeting. I just want to clarify. I know, Phil, you spoke about the word field and brought up our discussion from last month's meeting about that. But was that in relation to approving the minutes as stated, or is there something that was
As
missing?
stated, I just wanted to add that as not an addendum on the minutes, but just
Okay.
an added to our conversation in general
Okay.
about
Okay, I just wanted to
keeping our
confirm that.
eyes and ears open,
Yes,
and then having some ability to get feedback.
yes, you are heard, yes.
Also questioning who's making this, who's the decision maker.
Certainly nobody asked my opinion or Steve's opinion or any of ours opinion. And yeah, and I think our whole IMA discussion and answer makes us vigilant. So we will remain vigilant. I just wanted to confirm that about the minutes, Steve, but
Thank you.
that is all for me.
I may have confused that issue, so thank you for clarifying.
You're welcome.
Moving on to the next item, which is our regional opioid settlement funds. I have invited Sue Christensen. I'm not looking for a presentation, but she has been quite involved with the Fitchburg end of the settlement funds, so she can help us. I don't know if folks want to have a discussion. Maybe we just start with, is there any interest in pooling? Because that's what DPH is actually looking for, is for the MPHN towns to pool funds. Obviously, you need a goal to be able to pool funds to get to that. But
I think maybe
I know this can be a political topic too, so I understand walking in eggshells here.
I think maybe we want to clarify with the cities and towns too who may already be working on this and who may be interested in pooling to move forward. And I certainly would love to defer to Sue for a background explanation.
Royalston, for us, it's a pittance. It's like, it's less than $1,000 or $1,200 or some amount. And I just assume, what we tried to do, and actually I have to follow up, I think we allocated to a North Quabbin group, but I just assume pool it and not have to deal with the follow-up, like where's this money going, here's a conference, is this, for us, it's such a small amount that the administrative piece is just, it's a burden. It just is. So I just want to not get into some jam down the road because I didn't do something administratively. And I like to see the money go to something that's working on it. So, and I'm sure like Phillipston is a small amount. Do you know?
I actually don't know. I was kind of did a little circle here because it's like, if we're getting some, where's it going and who's monitoring it?
And how's it coming? So it's kind of a question mark for us, little towns.
So maybe we leave it as the towns will go back and take a look at where funds are and whether you're getting disbursements and whether it's being spent or not, and then make a decision from there.
I mean, pooling is really the way to go. The amount of money that some of us are getting, it's, you can't run a program. You just can't.
That seems to be the trend that the DPH is speaking toward, is that it does make sense to pool and do more regionalized programs. But just sort of at the beginning stages of that here, checking to see who's interested in that.
And I guess a part of the thing is the media got wind of it. And I've seen some stories in the Globe. There's this settlement, and no, they haven't spent the money yet, and they don't know. So, anytime, the media tries to find things wrong, not what works. So I think there's some heat coming from that.
Well, there was also a period of time where you couldn't spend the money until there was legislative approval, and that didn't occur till just December, so we only had a few months to organize things. All right, so it looks like our next move is to just go back and see if it's even worth a discussion, go back to our towns and locate the funds and then have a discussion.
We'll keep it on the agenda for next time.
Yeah. So table that item.
Is there, might just add, are there any towns that have something in the works now that would actually be excluded from inclusion in that? Do we know of any towns that have something in the works? Doesn't seem.
In Westminster, I was talking to my town administrator about this, and she had said something about working with Gardner, and I didn't know where that came from, so I don't know. But if we already have something set up, I'll talk to her today and see where that's at, then we would not be able to. But I don't know if it was specifically Gardner Board of Health or if it was, and I apologize, the name of the organization is escaping me, but they do work regarding like drug use. So,
Do you have any comment on that, Micah? Do you know of any involvement with Westminster?
I do not.
Okay.
I can check with our prevention coordinator and see if she's had any discussions.
Okay. And Michelle, do you know of anything that your Leominster is working toward? Not at this.
I believe Stacy knows.
Oh, okay.
So far, it has gone through the mayor's office, and I know there have been proposals. I don't know if that has been paid out or not, but that was the last I heard.
Okay, so maybe.
Do you have a comment, Sue?
Yeah.
Could you come to the microphone?
Speaker.
Westminster.
Sue, can you come up to the microphone? Thank you.
Hello, everyone. Ashburnham, Westminster, and Gardner have combined forces to provide funding to Gamma, who works regionally in that area. As far as I know, I think a few of the other little towns out there may have as well, but I'm not sure about that. I attend biweekly meetings on the opioid settlement, and despite what the media says, many of the cities and towns in Massachusetts are at the same stage we're at. We did do a survey last year. We started out with people with lived experience, people that work in the field, just to kind of get an idea of what folks were thinking about what the money should be used for. We received no surprises in that survey: housing, supportive housing, treatment, emergency shelter services, things like that. That was a really jumped out as the real big asks. We are in the process of finalizing a digital survey that will be put out in English and Spanish shortly, and have plans in the works to do a public input session at a Board of Health meeting to get input from the community as well. As far as the outline of the requirements from the Attorney General's office, they're pretty specific, and the communities really have to do a very large public input process, which we are ready to roll out before that funding is spent. So I think once Fitchburg gets their ducks in a row and we are able to move forward and have a plan and have input from our community, we'd be in a better position to talk to the other communities about how we can combine forces and what would be the best way to do that. I'm not sure the smaller communities, if they were required to do the public input before money was assigned or how it was done, but I really want to follow the guidelines that were set forth so that we're doing it properly. So that's where we stand.
Thank you, Sue. Any further discussion on the opioid settlement funds? Moving on to announcements. Is there any new, old announcements from the MPHN that folks would like to share?
Just a reminder, FEP meetings in person next Thursday at Mead Street, Worcester Public Health, 9 a.m. I think there's still a Zoom contingent, but canceled from our April snow day.
So the next meeting is next Thursday. Is that May? May 2nd?
Yep. Yes.
Yeah.
Is there any other announcements? Hearing none, I'll entertain a motion to adjourn.
Are you putting a next meeting date?
That's a great topic.
Just reading the agenda there, Steve.
Yeah. Does it say that? Yes, it does. Imagine that. So we've had discussions about this morning. There was a proposal for monthly meetings, but I think that's a little excessive. Maybe every other month?
As long as we get
Does that
every
work?
other regular meetings.
Does this date of the month, the last Wednesday of the month, work for,
Most of the time.
yeah?
So that would bring us, Steve, to June 26th. Wednesday, June 26th would be skipping the month of
Right
May.
before the 4th of July, so before
Yep.
people take off or do whatever.
Would that June 26th date be too close to 4th of July weekend and
No.
might be a problem?
And that works for FATV,
Well, I
to
don't
my
think I'm
knowledge.
present. I don't believe
I ain't
I'm
gonna be
around
there
that week.
Yeah,
Oh, you're not around.
26th. You gonna do an in-person again?
Well, it's up to the MBHN. This seems to be somewhat successful.
Yeah, it's got parking, and 10:30 is a good time, gives us a chance to get out and about.
Well, let's keep it June 26th then.
Are you in the office that date, Steve?
I can probably join from sunny Florida.
Plus, we got
I'll join from the last.
the man behind the curtain.
Man behind the curtain.
Yeah.
Yes, they'll make it happen.
Pay no attention.
You're always joining meetings on your vacation. Our director is very dedicated for the public's knowledge.
Thank you for that. May I entertain a motion to adjourn?
Motion
Now?
to adjourn.
Motion to adjourn.
And a second.
Second.
We are adjourned.